Okay, well, I know I was kind of rushing to get this last slide in, and I never want to make you guys late for Nemer. Mostly, I don't want to get in trouble. No, I'm just kidding. I'm joking. But so let me talk about, let me just refresh something. Everything that I talked about yesterday, all of those hormones are found in the anterior pituitary, and oxytocin and ADH are stored and released from the posterior pituitary. And I talked about the job of ADH. So each hormone has a job, and it is released in response to something. So when you're studying these, think about why the body would need this hormone. What would the body detect? What is the job of that hormone maintaining some function in the body? Now, oxytocin, its effect is primarily in the female, and when the body detects that the fetus has grown to size, it's going to detect fetal weight, and it's going to detect hormone levels, because progesterone is going to be maintaining the pregnancy. We talk about that next week. But oxytocin is going to initiate the uterine contractions, and then it's also going to help with the milk letdown, because after birth, the assumption is, the offspring will nurse immediately. So now there is a synthetic version of oxytocin, or we mentioned it yesterday. If you're a woman in the hospital, you might be given a drug called Pitocin, which is the same family. In veterinary medicine, we carry injectable oxytocin. So if an animal comes in and they're having dystocia, which is difficult birth, as long as we confirm there is not a pup or a kitten or whatever stuck in the canal, because you don't want to induce uterine contractions if there is a fetus stuck. So sometimes what happens is dogs go to give birth. Not every dog was meant to be bred, and not every person is a breeder. So sometimes if it's an oopsie and the family has not been feeding the dog well and understands the demands of a pregnant dog, and they're malnourished, or they're in poor condition, or sometimes the fetal size, but sometimes they get this weak uterus, and a shot of oxytocin will just help those contractions. And sometimes we can get them to give birth without having to do a C-section. Now, if one was stuck, we would obviously do a C-section. But some of these hormones have injectable forms that we can use to manipulate situations. Oxytocin would be one of these that we would carry. And again, you don't use it a lot, but it's there if need be. Now I'm going to be talking about what I call the satellite endocrine organs that are outside of the pituitary. And these are some of the major ones. There's a few other smaller ones that do certain jobs. But we're going to start up with the thyroid gland, which is in the neck. And it is right on the larynx. Let me see if I can. Let's see. And hopefully you guys can still see my screen. So if you look at right here, okay, and I know maybe this picture is not super big, but if you've got, this is ventral, and you've got the trachea and you've got the larynx, there's a pair of glands on each side. So they're kind of like they make a butterfly on each side. Now, technically, if you look at this technique, you can actually feel the thyroid gland. It should not be prominent. It's really kind of flat-ish to the trachea. The other key is that it should feel the same on both sides. If you feel a bump, they should be symmetrical. I have a hyperthyroid cat, and one side is much bigger than the other. And I can just reach up and I can feel, and I feel a bigger bump on the other side. Now, so this is a common technique during a physical. The doctor will try to palpate and see if they can palpate the thyroid gland. But this is where it is in pictures. I thought there was a similar in people. It is extremely hard to see. Here's a dissection image. There is the trachea. It would be on each side. Sometimes we have found a few of them during dissection. So usually I'll have you cut down here on the neck, remove all of that skin, and see if you can isolate the thyroid gland. You might, but you can see it's extremely difficult. Do you see there's a little pink tissue right here? And let's just see if I can find a better one. It's not easy. It's definitely, and it's not a very big, prominent gland, that's for sure. So, but you get an idea of where it is. So it is in the neck. It is, like I said, if you stretch up the cat's neck and you feel back and forth like this, you should, you know, normally you don't feel anything very prominent there. It does, and technically those two lobes are connected with something called an isthmus. So it connects the two lobes like a little band of tissue. But the follicles, they actually produce thyroid hormone, and they produce something called calcitonin. The main thyroid hormones are thyroxine and triiodothyronine. Tri, T3, triiodothyronine, and thyroxine. Most people just refer to them as T3 and T4. And that's fine that you know T3 and T4, okay? The active hormone is the T3. The pro-hormone is the T4. Now, the stimulus for these to be released is actually when the hypothalamus detects that thyroid levels have dropped or thyroid levels are low. TSH is going to be released from the anterior pituitary, and it's going to go to the thyroid gland and have it release hormones into the blood. So the target of TSH, thyroid stimulating hormone, is the thyroid gland. Now, the job of the thyroid hormone is basically controlling the body's metabolic rate. It does have a calorigenic effect, meaning it will burn calories, stored calorie, you know, if obviously you get calories from your food, and then there's stored non-carbohydrate sources of energy in your body. So if the body has to access that, it can. It also maintains a normal body temperature. So the thyroid helps you normal temp, and it's the calorigenic, or keeps the metabolic rate. It can basically cause, you know, synthesis of proteins, maintain blood glucose, because again, if more energy is needed, the body's going to need more glucose. Catabolism of lipids. So that's breaking down the own body's lipids or fats. Okay. What I want to say, and I'll give you, so thyroid animals are fairly common in practice. You have two sides of thyroid disease. You have hyperthyroid, you have too much, and hypothyroid, we have too little. Cats are typically hyperthyroid. Most cats are hyper, most cats are hypo. You can occasionally get a hypothyroid cat. Potentially, I'm trying to look back if I've ever seen a hyperthyroid dog. Probably. but I feel like the cats really stand out to me. So my own cat used to be, she used to be 20 pounds. She was a chunk-a-monk. We bottle fed her. She's the alpha of the house. We call her our little BI, you know what? And she lived her life. And then we noticed, it was like maybe 2 years ago, she started trying to jump on the table and she started to try to steal food. Like seriously jumped on the table, took a whole chicken nugget off my son's plate, growled, ate it under the table like she had just caught something and killed it. And but the other thing was she started losing weight. And when she first started losing weight, I was paranoid about renal disease because of her age. She's getting up there. But the thing that was interesting was that I'm like, she's losing weight, but she's starving. Like the cat eats anything and everything. And I literally mean anything and everything. And so my husband's like, but no, we want her to lose weight. She was overweight. But I said, I haven't cut back her food. I haven't put her on a little kitty diet plan. I haven't put her on a kitty treadmill. I've done nothing to make this cat. Yes, do I want her to lose weight? Sure, but I wasn't doing anything to make her lose weight. What was happening was her increased metabolic rate and calorigenic and catabolism of lipids. So she was losing fat and she was losing weight in the face of being hungry. So I was trying to feed her more. It ended up, long story short, I still have her. She's 14. She is very, very skinny. Hold on one second. So I've tried to feed her more. She didn't respond well. There's pills that they can take to supplement. And the other thing you have to figure out is but when I felt her neck, I felt the enlarged thyroid. She's continued to lose weight. There's an ear cream that instead of pilling a cat, because most thyroid meds are twice a day, which pilling a cat twice a day for life is not fun. And on top of that, I'll try and find it. Okay. I don't know. On top of that, that's difficult. But what was I going to say? Oh, I totally lost my train of thought. So she's trying to eat a lot. She didn't respond. There was an ear cream medicine. That's what I was starting to say. If you don't want to pill them, they can put the medication, and it's called transdermal. And you put a little finger cover on, you put it and you rub it in their ear. Yes, I'm just seeing your message. Yeah, methimazole, transdermal methimazole. So I get it compounded. I was getting it compounded at a pharmacy in Noblesville. So most of the time your vet doesn't carry it. You have to get it from a compounding pharmacy. And some respond to it. She was getting quite, I figured I would show little Miss Thing to you. So I know it's probably hard to see, but she's very skinny. I need to post a picture of what she used to look like, how heavy. She's also very, she's very wiry. Heart rate's a little high. She's always very, like, the kids are like, she's jittery because of that increased metabolic rate. It makes them feel on edge. So she can get she's definitely not 20 pounds. Now this has been over some years. The problem is she's terrible to treat. She's terrible to go in to take blood. When they have thyroid disease, they have to go in and have blood levels checked. And here she's already growling. Hey, Gabe, she's coming towards you. Sorry, I had my son bring her in. Just put her back on the other side. She's definitely, you know, it was to treat her. I thought I could try to treat her, but they have to go in for regular blood checks. She's awful. It stresses her out. So we've just decided I'm just, you know, keeping her comfortable. I feed her. She eats the puppy food. She eats Bo's food. She tries to eat our food. I feed her more food. So that is a cardinal sign of hyperthyroidism, is they're losing weight in the face of wanting to eat more. Now on hypothyroid, because that's we're now in a low metabolic state, most of the time those owners are like, my dog is lazy, sleeping all the time, overweight, and that's one of the signs, kind of their unkept coat. The other thing about the temperature, sometimes we used to call them thyroid animals, we call them heat seekers. And it can be heat, it can, sorry, I knew that was coming. Sometimes the owners will say they're sleeping on the, thank you, they're sleeping on the vents, and it can be cold or heat. But a lot of times the hypothyroid ones, especially in the winter, will lay on the heating registers on the floor because their thyroid is not maintaining their body temperature as well. So we call them heat seeking, or they're looking for sources to stay warm. But I've even seen them in the winter try to lay, but this cat, she sometimes will lay on the register. When it's blowing heat, she'll just like lay on it. Now she's not shivering, and I've actually taken her rectal temperature and it's always been normal. So it's interesting that she does do that. But it's fairly common in practice. The thing when it's diagnosed, we have to figure out, is it an issue with the gland, with the T3 and T4? Is the gland overproducing, or is it a TSH issue? TSH is being released, and it's causing an overstimulation of the thyroid gland. Because see, there's two parts to this. There's TSH, and then there's T3 and T4. So normally, oh yes, you know, because you're talking about the owners, amen. So what Ireland is saying, and this cracks me up because yes, this would drive me insane. These pills come in, like there's a whole row of these pills because they're like 0.2, 0.6, but you know, there's different strengths of these thyroid medications. And yes, they're all different. And this is why blood levels are checked, because sometimes animals will be on one dose and then they have to switch to the other tablet based on blood levels. So there's a lot of blood work and coming back to the vet for thyroid disease. What happens is these pills are tiny. They're on it for life. So you have the person that comes in that says, yes, I want my refill of 180 pills. And you're sitting back there with their little pill counter, 2, 4, 6, 8. And they always come in when you're super slammed. So I would agree, Ireland. Or the lady that's like, I need it now because I'm out. And I'm like, so you didn't know you were going to be out 2 days ago when you could have called me and said, I'm going to pick it up tomorrow and give me time to count it. So they always want it right now, and then you got to drop everything and count a bunch of pills. So thyroid, again, hypo versus hyper. It also hyper increases their heart rate, respiratory rate, makes them anxious. But the other thing that the thyroid gland does that can't be neglected, okay, I thought I lost my mouse and I was going to freak out, is it produces calcitonin. And it's basically, there are C cells right between those follicles, but calcitonin maintains calcium blood levels. But what it does is it's preventing hypercalcemia. So if for some reason calcium levels are elevated in the blood, okay, they're too high, then what calcitonin is going to be released from the thyroid gland. Hypothalamus sends a releasing factor, releasing factor gets sent to the thyroid, calcitonin is released, and it takes the excess calcium and puts it into bones. And that's how, so then calcium levels are not in the blood. Calcium moves from the blood. Hey, Gabe. Calcium levels move from the blood and they move into the bones and it brings it down. Now, parathyroid hormone also has a role. Hey, Gabe, what? Did you close the sunroof? I don't know. Joey had the car. Sorry. My daughter used my car yesterday and left the sunroof open. So when I went out there this morning, I'm glad it didn't rain. Anyway, okay, parathyroid hormone is going to do the opposite. Parathyroid hormone can be called parathyroid or PTH. It is produced by the parathyroid glands. So they are very small little nodules. They're right by, I say they're paired by the thyroid. That's how I remember parathyroid. They're paired by the thyroid. They're not the thyroid gland, but they will keep calcium levels. They will bring up calcium. So for example, if we have an animal that is hypocalcemic, not enough calcium, they are going to, parathyroid hormone is going to be released from the parathyroid gland. It's going to go to the kidney, going to tell the kidney to not urinate out as much calcium. So by that, it's going to raise calcium. It can also signal the intestines to try to absorb more calcium. In an extreme situation, if the animal was not getting calcium in the diet and we couldn't retain it anywhere in the body, it can pull it from the bones if need be. So it's going to try to cause the kidney to retain it and the intestines, because remember, those are the two locations we're getting rid of things. So they're like, keep the calcium, we need as much as we can, and potentially pull it from the bones. So it is the opposite of calcitonin. So for this section, you need to know which one raises calcium and which ones brings it down. So parathyroid hormone will elevate calcium. Calcitonin will lower. Think about this. Calcitonin is going to tone it down. Calcitonin is going to tone it down. So if it's too high, let's tone it down. Parathyroid is going to try to bring it up. So are there any questions about that? So we got the thyroid gland and the parathyroid gland. Parathyroid gland makes parathyroid hormone. Thyroid makes T3, T4, and calcitonin. Okay, so for each gland, make sure you know this gland produces these hormones, and this is the effect when these hormones, what's the job of these hormones? Why are they released? Now the adrenal glands, anatomically are, so you've got here in the abdomen, you've got the aorta, you've got the vena cava, there's your kidneys. Remember I said with the kidneys, and the kidneys can help blood pressure. This is kind of like a good little spot because you've got the kidneys, you've got the major vessels right here. We can exert changes on the blood pressure. These two tiny little glands are extremely important. I'm going to tell you, this is another thing. Just like the pituitary. Remember I said the pituitary is one structure, but inside it's two glands? Same thing with the adrenal gland. It looks like one little bumpy thing, like it looks like a shriveled up raisin right there. It's kind of strange. When you cut it in half, there is actually a cortex and a medulla. Cortex and a medulla, and it's surrounded by a capsule. So there are two glands inside one structure. So that's what the pituitary and the adrenal glands have in common. One gland, two structures. And you add renal. They're right next to the renal, they're the kidneys. Add renal. So that helps you remember where they are. Now, the adrenal cortex. Now I'm talking about the outside. The adrenal cortex produces glucocorticoids like cortisone, cortisol, corticosterone. Wow, why do I keep saying Court. This is when if you were all in front of me in class and people get, and then they're like, God, our teacher is so strange. Put the mental connection together. Adrenal cortex, glucocorticoids, which are called cortisone, cortisol. If I ask you where is cortisone or cortisol produced, it's produced by the adrenal cortex. Glucocorticoids, what they do in general, these are natural in the body, okay? Cortisone, cortisol, probably the main one we think about. Okay, we should talk about that. That's interesting because it's fairly common. Cortisol is probably the number one I think of, and then you've got cortisone, but they will cause a hyperglycemic effect. They help maintain blood pressure, but big here, resist the effects of stress. And I started to talk about this the other day. What's stressful for a dog? Doorbell ringing. Company comes over, and I lose my mind. Mailman stops by. You know, there's things that are going to like be a stressful event. And obviously if it's a stressful event, then if they're kind of preparing potentially for fight and flight. And you're going to get this hyperglycemia because they're trying to be ready for this response. They're trying to boost sugar, boost blood pressure. They also produce mineral corticoids, but think about minerals. Aldosterone is one, but they regulate electrolyte levels. So very important when we're evaluating animals for adrenal disease, we always do an electrolyte panel, because one of the key markers in adrenal disease, if we suspect it, is electrolyte levels will be off. So sometimes, we're talking about potassium, sodium, chloride, sodium, potassium, chloride, things like that. And we can supplement with fluids, but we have to figure out where they are deficient or where they are elevated. They also do help produce the sex hormones, androgens or estrogens. So when an animal is spayed and neutered, okay, that's the main source of the sex hormones in the female or the male. When they're spayed and neutered, they do still have some sex hormones, not for breeding purposes, but for basic body functions. Estrogens and androgens help with body function. So it's not like they're completely taken away when they're spayed and neutered. Now, when you look at the inner gland, which is the medulla, this is separate, and it looks a little bit like nervous tissue. It's resembled brain tissue almost. It produces epinephrine and norepinephrine. And it is controlled by the autonomic nervous system, fight and flight. So basically, when an animal has that stressful event, okay, we need the stress hormones, cortisol. We need the norepinephrine and epinephrine to put the body in a sympathetic state that will help the animal fight and flight. It's just the mailman. No, we're not needing to attack or protect the family, but in the dog's body's mind, that's what they're supposed to be doing. Now, Ireland, if I can ask, what was your dog doing that you knew that it was Cushingoid?
So funny thing is I felt bad about this because I didn't really notice anything, but now that I know she's Cushingoid, it makes sense. She was PUPD and she has a pot belly.
And that is, so everyone's like, okay, my dog's gained some weight and they're drinking more. They're more thirsty today. I mean, a lot of Cushingoid or Cushing symptoms mimic so many things, or are things that are kind of vague. If you know what yeah. Did she have the blood work, the ACTH?
Yeah, so I actually just pulled it up so I could tell you her ALP was 290, her glucose was 113, and then her platelets were a little high. They were at 515. So she just has like the very beginning stages of it.
Is she on medicine for it yet or not yet?
I'm not gonna treat it. Veteral's just so expensive and it's not gonna show much improvement. She's like 11 at this
Yeah.
point, so
Well, that's my thyroid cat. I mean, the
yeah.
amount of times I'd have to take her in for blood work, I think she'd probably have a heart attack just going in to have. I mean, the last time she was there for her diagnosis and one other draw, they were like, yeah, there was like three of us holding your cat. And I'm like, I know, I'm sorry. She's not happy.
I mean,
So
she would be fine for the routine blood work, but it's just not worth it to spend all that money for
right,
what, like a small reduction in the symptoms and maybe another 6 months added to her life.
I agree. I agree. I was gonna I was gonna add to this on the opposite side of Cushing. So Cushing's is usually an overproduction in the cortisol, and it's causing like the PUPD, the pot belly. Sometimes their skin gets kind of thin. Sometimes their belly, or like on the sides of the flank, sometimes they lose some hair. So it does have but I've seen dogs that present like that it wasn't that, so it's kind of nondescript. But if you've ever heard of Addison's disease, Addison's is the flip side. They are deficient in producing these hormones. So they're deficient in typically producing epinephrine and norepinephrine or cortisol. The first Addison's case I saw, the lady rushes in with her Shih Tzu and they rush it in back, and the dog is pale. It has like a heart rate of 30. We are like, oh God, get a catheter in. We're getting fluids. The dog like poops out this gross stuff. I was like, what is happening? And we're working on the dog, and all of a sudden the dog just jumps up, starts wagging its tail. It's like it came back to life. And we're kind of like, because we're trying to figure out, we're like, for sure this dog got into a toxin. We're like, what did this dog get into? She's like, it didn't get into anything. It's no, I have no medication. And I'm kind of like, what? Are you serious? And when we take the blood pressure was low, but it did come back up. And then while we have the dog in the cage, another dog comes in. This dog flops over again. So now it happened in front of us. We're like, oh, okay, now we know what she's talking about. We get the dog back out. But when we ran its electrolyte levels and they were off, and Addison's disease has the opposite, is where if they have a stressful event, they cannot respond. And so the body uses a lot of resources. And the lady said at home, somebody just rang the doorbell. That's why I bring up that analogy. It's kind of like, bring up the doorbell. Normally the dog would lose its mind. And she's like, he kind of just, and then, because the stressful event bottomed him out. So there's two sides to this adrenal diseases, is normally the Cushing's. And like Ireland was saying, there is medication and blood work that you can use for it. It's fairly expensive, and Addison's is the same way. We're just treating the opposite problem. And basically we're trying to get them into a normal balance. So you got Cushingoid, and you'll talk about this in some of your endocrine diseases class. And then you've got Addison's on both sides of that. Now, I want to bring up something because I know I'm teaching anatomy. I know you have diseases later. I feel like when I teach this stuff, I always want to give you an idea of things that you're going to see, because why are you learning this? Why is it important to know what the adrenal gland does? Well, when you talk about it in pharmacology in your disease class, but also if you remember anything I say down the road. One thing is, when dogs, a lot of animals are put on prednisone. Prednisone, now prednisolone is usually used in cats. Prednisone is typically used in dogs. And it is a steroid, and it is a glucocorticoid. So let me give you a perfect example. Dog has allergies. Owner goes to vet. They say, let's put your dog on pred. Owner's like, this is fantastic. My dog has stopped itching, because prednisone is basically going to help. It's anti-inflammatory. So for allergies, it's going to decrease that inflammation. The problem is long-term prednisone can cause some PUPD. It can almost push them into Cushing's if the dog's been on long-term pred. But what it happens is it is like cortisone. If you've heard of cortisone cream, okay, so cortisone is a natural glucocorticoid in the body. It can also be given as a drug, corticosterone, steroids. When a dog is on steroids, this gland, okay, is not producing these things because the body we are giving the dog what we call exogenous steroids. We're giving them exogenously. We're giving them to the patient versus using their own. What happens is that gland starts to shrink because the body, it's not working out. Kind of my analogy is if I live next door to my grade school and you have to walk 2 miles to your school, obviously your muscles are going to be more built up than mine because you're walking, you're using your legs. I'm literally right next door. What's happening when the dog gets pred is the gland gets a break. He's like, I don't have to do anything. When owners stop pred immediately, they stop it abruptly, and then that animal needs these things for a stressful event, the gland may not be ready to produce those because it's not been working. It's not been producing those things because we've been getting it via a pill. So very important when you're in practice, whenever we give an animal prednisone, we do what's called a taper dose. For example, my dog was when Bo had meningitis when he was 8 months old, and he was put on high dose pred. He had to be put on immunosuppressive pred because of his meningitis. I want to say his initial weaning dose was 4 months. Now, he was getting a lot of pred. That's a little different, but it was like 30 milligrams once a day for 3 weeks, then 20 milligrams once a day for 3 weeks, then 10 milligrams once a day for 3 weeks, 10 milligrams every other day for 3 weeks, 10 milligrams every third day for 3 weeks. Do you see what we're doing here? We're trying to get Bo off of pred, but I don't just stop it one day. I'm going to slowly decrease the dose. What that does is then this gland will start to reproduce again. It's like, okay, let me get you working out again because I'm going to take away the pred and I need this gland to start producing. So the best way when an animal is on steroids is to do this weaning. And I was always very upfront because owners are very famous for, oh, my dog's fine. He looks good. I'm going to stop giving him medicine. I always told my clients, I said, whatever you do, follow these instructions. Don't run out of this medicine. You have to wean this drug properly in order for the gland to start reproducing its hormones. Does that make sense? It's kind of like a muscle that's not been worked out. Owner stops it immediately. The gland is needed. It's like, hey, I've not been doing anything for like 6 months. Now you want me to like completely function as normal? It's not going to happen. Now, if you're doing a week of pred for like a skin thing or 2 weeks, but a lot of vets and a lot of clients just want the quick fix and want their dog on a steroid. So basically a steroid like prednisone, dexamethasone, is mimicking their glucocorticoids and they're causing these effects, but the owner needs to be aware. And it's usually the technician's job to discharge these patients. So we're the ones that are going over the medication instructions. So now you, again, like I said, you'll go over endocrine diseases, some more classes, and when you do pharmacology, you talk about the glucocorticoids. So I want you to understand the relationship between giving pred and then the body's natural steroids. So any questions about that? I think we're good. Okay, the pancreas And remember I said this is a endocrine organ, true by nature, and we've already gone over in the GI. It's along the bend of the stomach and the duodenum, but it has both endocrine and exocrine functions. So the exocrine component is producing something that needs to exit and to be deposited, which is the digestive enzymes. So the exocrine pancreas has its function at the duodenum. That's where it deposits digestive enzymes. Okay, just at that location. The endocrine pancreas releases into the bloodstream, and that will travel through the blood. The main two things that I want you to know is the alpha cells produce the glucagon and the beta cells produce insulin. The pancreatic islets of Langerhans is where you find these cells and these hormones are produced. So I'd say the two principal hormones to understand about the pancreas, because we already know the exocrine pancreas does the digestive enzymes. Pancreatic hormones, insulin brings down blood glucose, causes glucose and other things to be absorbed into the body cells. Actually, Sipes has a good analogy for this, and I don't know if she's had to talk to you about glucose or anything like that, but it's like a server, okay? If your food, you order dinner, and the kitchen puts your little plates, and sometimes if you've ever sat, this always frustrates me, if I'm at a restaurant and I can see the kitchen, and I'm waiting for my food, and I see plates sitting up there, I'm like, is that my food? Like, I literally want to just walk in there and grab it because I'm hungry, and it's right there. But it needs my server. I mean, I could see my food, but I wait for my server to grab my plate and bring it to me. My server is insulin. So basically what happens is when a dog eats a meal, insulin and then glucose is absorbed into the blood and it's kind of floating around, insulin's going to take it and give it to the cells. It's going to serve it to the cells. So what does that do? It takes glucose from the blood and moves it into the cell. And then the body can use it. Now, remember, the body doesn't use every bit of glucose. And basically, glycogen is stored glucose. Remember, the liver can store glycogen. So, for example, if I talked about leftovers in the fridge, 1 a.m., you're like, I'm hungry. I'm going to go grab some of my leftovers. The body can access that. So glucagon is going to be signaled to be released. Glucagon is going to tell the liver, hey, take that glycogen that you were storing for me and turn it into glucose. And that's called glycogenesis. And that's the creation of that glucose. So they're taking stored glucose and converting it. So again, the body can access. So again, if I ask you what hormone raises blood glucose, that would be glucagon. If I said what hormone drops blood glucose, that would be insulin. The issue with diabetics is typically the insulin deficiency. So in that case, you are giving diabetics injections of insulin because for some reason, and that's why they have elevated blood sugar. I mean, if they're going to come in, normal blood glucose is about, I think it's, depending on your blood machine, it's about 80 to 120, 70 to 120, in that range. We've had diabetics come in high of like 300 to 400 glucose. Okay, that means the glucose is in the blood and it's not in the cells. So your brain might be going, well, there's a lot of glucose. What's the problem? The problem is it's in the blood and it's supposed to be in the cells, okay? Every blood test that you will learn in school, there is an acceptable level of something in the blood. Like Ireland was saying, ALP, one of the tests we do for the liver. There is an acceptable amount of ALP. There's an acceptable amount of BUN. When I talked about BUN, blood urea nitrogen, glucose. All of these, we call them chemistries. These are different chemicals in the blood. There's appropriate levels. Again, insulin's job is to take that from the blood and give it to the cells. So this is just the flip side on both of those. And then let me just start. So does anyone have any questions about the pancreas? And you'll get into diabetes again in the endocrine diseases. So the gonads, which are the reproductive organs which produce hormones, the testicles in the male, or the testes, ovaries in the female, obviously they mostly produce the reproductive cells, but they produce hormones. So again, I'm getting into the anatomy. This is what we do next, is we do reproduction. So I'm going to get into these, but basically the testicles, which are in the scrotum is what you see on the outside of the dog. Within the scrotum, there are the testicles. If you cut one in half and looked inside, this is what we're looking at. They have these seminiferous tubules. So these are like tubes. And this is where the spermatozoa, which is the infant sperm, this is where spermatogenesis occurs. This is where the mature sperm are made. Now, in between the seminiferous tubules are interstitial cells. And that is where the hormone is produced, primarily testosterone. So the androgens, the primary androgen or sex hormone in the male is testosterone. Obviously, this is why when we castrate a male, we hope to take away, because a lot of times animals with excess testosterone kind of have that bravado. Now, the ovaries are a little more complex. And they produce an ova, or an ovum, which is a mature egg, and they produce hormones. There are different hormones in different levels. The main three now, this is important to understand. The ovarian cycle is controlled by the pituitary via FSH and LH, follicle stimulating hormone and LH. The biggest problem that students have on this test in this section is that they tell me that these hormones are produced by the ovaries. These are produced in the anterior pituitary. When they are released, their target is the ovary. Because remember when I said it's time to start a cycle, FSH is going to be released. It's going to stimulate the follicle, and then it's going to trigger estrogen, and it's going to trigger the ovum. And the ovum and estrogen start growing together. They're like a pair, kind of. So as the ovum gets bigger, now it's an oocyte, estrogen's going to go up. But there's also progestin and relaxin. So estrogen, basically, when FSH stimulates the follicle, it starts to grow, releases estrogen, and as estrogen goes up, the pituitary is going to drop FSH because it's like, you're done. We've started it. You can take a break. LH is going to start to go up. So when the egg is fully mature, LH is going to peak and estrogen peaks. When all of that peaks, this is when they ovulate and release the egg. And then progesterones are going to come in after that. But I know I don't want to push you guys to Niemer's class because I'm going to get into this. And I do talk about this more in depth next. So I'll get more into that. So does anyone have any questions for today? Okay. So my goal, we only really have a few more slides, would be Monday, the homework is due. So my goal would be Monday to finish these few slides and then to go through the homework and have the quiz on Tuesday so that we can start reproduction by Wednesday. And then depending on what I can do with dissection kind of helps me plan the next 2 weeks. So I need to get an answer from Dr. Ritz. And then once I get that answer, I'll talk to you guys about that. So I will send an email this afternoon with yesterday and today's video. And if you have any questions about homework, email me. I'm around this weekend. But that's going to be our plan to Monday finish this, go over the homework, quiz Tuesday. All right. Well, if not and nothing's needed,